Hi, thanks so much for joining. We'll get started in just another minute, but for those of you who just joined, you could please just put your name and the city that you're either from or representing into the chat. We'd love to see where everyone's coming from today. Okay, I feel like I'll get started now. That's a few minutes past 2. So thank you so much for everyone who is joining us today. I'm Callie. I'm the program coordinator here at the dashboard. Um, and today I'll be hosting virtual ops hours. Please note that this session is going to be recorded, so we'll be putting it onto the site shortly after we're done today. And I'll also send it around to those who registered to view. If We'll also be sending around a survey afterwards to get your feedback to see how we did today, as well as how we can improve for future sessions. Um, and yeah, so we'd love to hear your feedback. Um, I will give a little overview of the dashboard and some of our education related metrics, and we'll close out with a Q&A, but I did want to note that today's a pretty small group, so feel free to pop in, ask your questions. It'll be pretty informal. And I know that um, yeah, let's just keep it informal. So let me know if you have questions along the way, and we're here to help. If you have questions throughout, pop them in the chat. We'll have our team monitoring it, and otherwise, just ask. So here at the City Health dashboard, um, we launched in 2018, and our goal is to really help cities across the US use data to improve health and well-being of everyone in their community. And so how do we do that? We have now over 970 cities that we have on our site. Um, and we have over 40 measures of health and the factors that shape health and drive health equity to really help these cities hone in on areas that they can help improve within their communities. And so when we launched back in May of 2018, it was developed here at NYU's School of Medicine in the Department of Population Health. We worked really closely and collaborated with the NYU Wagner School of Policy, as well as some of our partners, including NLC and ICMA. And we had 4 pilot cities when we began, and we really worked with them to create this easy to use one-stop resource to help all of you guys be able to help make healthier communities. So our goal here is to really be that one-stop resource for you, for any user, including health professionals, city leaders, everyday community members. And we do that by developing and testing our site and metrics with a diverse group of community and city leaders, continually improving upon and upgrading our site. So we'll frequently have those and send those out to our users. We make sure to carefully check all of our metrics, and we have really stringent criteria on what can be used on our site for metrics. And then our initial implementation user testing is used to ensure that our site can be used across a wide range of audiences. And finally, we create our site in close collaboration with real website experts. Um, so how do we select our criteria for our measures? We make sure that each metric that we have on the site is coming from a national data set and covers all of our cities on the site. We check to make sure that each of these metrics has rigorous underlying methods and the original data collections, that we can really stand behind all of them. We make sure and we aim that all of our measures to be actionable at the city level and really reflect on public health priorities. And finally, we ensure that we regularly update and remind timely as times continue to change, metrics change. And we base these all under 5 overarching domains, which include these 5 here. So we have clinical care, physical environment, health outcomes, health behaviors, and social and economic factors. And these are encompassing of all the metrics that we have here on the site. Some of the ones listed here in blue are only at the city level versus the ones in yellow. You can see at both the city and the neighborhood level, which we break down by census tract. So that gives you a little bit of a deeper look at those metrics. And then when available, we also provide the demographic details, which it can include racial and ethnic breakdown, sex, or age. And so how do you even use the dashboard? So the dashboard can be used in a variety of ways, one of which is to really compare health gaps across neighborhoods. It can help you dig deeper into what is causing those differences as you compare among metrics. You can also compare among other cities. So you can compare your cities to cities in other regions or with similar population sizes or demographic factors. And this can help you set goals and learn from what others are doing. And finally, it can help you set priorities and better target resources to the neighborhoods that really need them the most. And all of this information is available on cityhealthdashboard.com. So that's our website. Everything's there. It's all free, easy to use, super accessible. So now I'll dive into a quick site overview. If you guys have any metrics of interest that you wanted to cover today, feel free to just slide it into the chat. But if not, I'll kind of go through the typical kind of site overview and look at that. But feel free to pop in if you have any specific questions along the way or anything you want covered. So this is the main page of the City Health Dashboard site. If you go to the homepage, and you can see here, you can see some of the research we've done, events, some impact stories or use cases, as well as any news. If you click here on the left, it brings you this little navigation bar. Take action are those resources that can help you find policies and programs, impact stories, or as I said, use cases. And then some of these other smaller things I'll get into a bit later, but one of them is accessing the data, which is free and accessible for anyone to do. So I'll dive in today to my hometown, which is Burbank, California. So we can use this as an example. If you click into your city, you'll be brought up with all of the metrics available for your city on the site. You can click into any of these here, but if you don't know where you really want to start yet, you can just always click at the overview. And if you go here, this gives you a brief overview of all the metrics in your city and how you're doing. And so all these bars, these colored bars, are what tell you where your city versus all dashboard cities line up. And the lighter colors indicate the better outcomes. They'll be indicated as well by the check mark to make that more clear. And the yellow bar is your city versus the triangle is the dashboard city average. And so you can see for some metrics in Burbank, they're not doing as well as the dashboard city average. And that's when the check mark is closer to the deeper colors versus when they're doing better, there's a green check mark that indicates that they're doing better than the dashboard city average. For education related metrics, which is what we're going to kind of focus on today in this virtual office hour session, a lot of these are kind of located in the social and economic factors overarching domain. And so we can see here there's absenteeism, which measures how often students are not at school. There's high school completion, which is when you're 25 or older and have completed high school or higher degree. And there's also third grade reading scores, which indicates the reading score at the third grade level. So today I'll just look at high school completion. And so if you click on this, you can see how is Burbank doing as a city level compared to the dashboard cities average across the nation. If we want to click into this more here, we can just click on the map and that takes us to this metric detail. Here you can see that high school completion is broken out by neighborhoods, and those are also synonymous with census tract on our site. So if you click into it, you can see the census tract number here, where it belongs within zip codes, as well as the value for that particular neighborhood average. If you want to, again, look at the city average, it's here on the left in this key, and this green check mark lets us know that we're doing better than the average of the dashboard cities. You can view all of this information in a table if that's something that is easier for you. I'm more of a visual learner, so I enjoy looking at the maps. If we want to, we can switch years here. We have, for this particular metric, all the way back to 2013. So if we go back to 2013, we can see how was Burbank doing for this particular measure, or we can just go back to the most current year, which I'll do now. Another easy way to kind of compare across neighborhoods and areas of interest is that if you click into one, if you click on the star icon here, it'll save it on the right within census tract values. And if you go to these saves and you don't want to click on that particular measure, you can just click on this eye icon and it will highlight the census tracts of interest. And so here we can now see these comparisons. And if we go between years, you can still look at, well, once it loads, you can still look at all of the census tracts still highlighted here to compare between neighborhoods and across years. So for this measure, actually, one last thing for this measure, if you want to know more about the metric, this gives you a brief description of what is this actually measuring. So as I said before, it's for adults aged 25 and up who have a high school diploma equivalent or a higher degree. If you click onto this more about the metric, it shows you the data source, any data availability. And so for this one, it says there is demographic data available, as well as tips and cautions. And if you want even more details on this metric, you can always read here for the one pager that goes into all the depth and calculations and all that detail. So if we look at the demographic detail page here, this will break it down by the demographics that we have available for this measure. In Burbank, we have racial, ethnic availability for high school completion, as well as sex. And so we can see that here they have similar scale bars. So it's kind of a similar thing throughout the entire site, which makes it easy once you understand one to understand all of the others. So in this case here, if we look at the racial ethnic breakdown of Burbank, first it gives you the city overview generally, and then here on the left, it'll show you, for instance, the Asian population. 11.7% of Burbank's adult population is Asian. And then we see here, if we show example, this will explain what the scale bar means here. It means of the Asian population in Burbank, 96.6% are graduating high school compared to 87.5% of dashboard city Asian populations. And so you can use this information as you kind of go down to compare across groups and see how our particular groups of interest doing in your city, which is, again, the yellow scale bar compared to the triangle, which is dashboard city average. Same goes for sex, and this breaks it down by female and male. So if you want to, you can also compare between cities. Now here, if you know what cities you want to compare your city of interest to, you can just type that into this search bar here. I have no idea what city I want to compare to, so maybe I'll use some of the city finder features. So here we can compare based on similarities within the city that I'm starting with. So I'm starting with Burbank, and so we can look at populations with similar size, or we can look at racial demographic groups, so racial ethnic breakdowns, poverty levels, or if we wanted to, we could go and break it down by those that have a similar range within our range for certain metrics. So absenteeism, I could click here and it would find cities that have similar absenteeism levels to Burbank, and then we can compare their high school completion rates. But say I want to compare cities that have similar population sizes, as well as similar Asian populations within those cities. You can go here, and if you click on a city to compare, that scale bar will now appear below so you can compare between those values. So I'll just click on 4 here. And if we scroll down, we can see how those cities are doing compared to Burbank's value up here. If you want their information to show up for the demographic comparison below, you can check here. If you don't, you could uncheck, and it won't show up in this little chart down here that will compare all the demographic details available. So in this instance, once again, it's racial and ethnic groups as well as sex. Now, if you don't necessarily want to compare between cities, but rather within your own cities, you're also able to do that on the site. If you go to the Compare Metric tab, here at the Compare Metric tab, you will have your original metric that you selected. So in this case, it was high school completion. And let's compare that against children in poverty, which is another metric in the social and economic factors. And so for this one, it's comparing across the same year, 2020, 2021. Again, this will give you a little detail about the metric and what it's measuring, more about the metric here for more information. And if you scroll down, if both are at the neighborhood level, you'll be able to see a comparison visually on a map. So for a visual learner like me, this is really useful tool to be able to see between the two cities. Your original metric will once again show up in that original blue gradient, while the comparator metric will show up in a gradient. So in this case, once again, the lighter colors will still be the better outcomes, but it's in the form of dots. So if you click on any census tract here, it'll give you the value for high school completion as well as the value for children in poverty, and you can compare amongst the census tract values here for these two measures. If you want a different way to view these data, you can also scroll down to a scatter plot view, and you can see if there's any associations for these measures, as well as if there's racial, ethnic, demographic groups, or any other information. Again, they will place those in comparison here. So finally, I just wanted to cover the last two tabs. The dashboard has Take Action resources, as I previously mentioned. And if you are on a particular metric in your city and you click on the tab Take Action, it'll filter those resources for that particular metric. So here we have high school completion, and all of these resources, if you click in, will be tailored towards that metric. So for instance, they're all in alphabetical order, and this first resource program and policy that comes up is alternative high schools for at-risk students. And so this is really focused on how to improve and drive change within your community for improving that high school completion score. And we have, as you see here, a few other options for how to really drive impact and action within your community, from partners to funding and programs and policies. And finally, if you want to know a little bit more about either metric being featured in certain places or your city, you can go to city highlights here. These are just some stories and blogs on our site that have featured this metric or that have featured the city. You can find those here. And the last thing I kind of want to go over in this quick overview is downloading the data. It's free and accessible for anyone to use, so please feel free to download our data. You may be prompted your first time around to fill out a quick survey to just let us know who you are when downloading the data, so that we can let you know if there's ever a new data update or release, so you're top of mind for us. And as you go down, you're able to find here the codebook, the technical document, which will highlight how do we calculate our measures, if there's any nuances you need to know. And then you can either download the full dashboard city data set, or broken down by state to make it a little easier to find your city. These are all for the most recent year of data. If you want multi-year data comparisons, you can use our API here, which has all data on the site available for you to use and compare. If you have any questions at all, feel free to email us at info@cityhealthdashboard.com. We're always ready and available to help with any data related questions. So that was a quick site walkthrough. If you have any questions, again, feel free to just jump off mute and let me know, or pop them in the chat. But I'll continue on now with the PowerPoint to kind of just dive a bit more now into the education resources that we have available on the site. So education resources, as I said, we have over 40 metrics on the City Health dashboard. There are 3 in particular that really highlight education. Those are these absenteeism, the absenteeism, the high school completion, and the 3rd grade reading scores. And these ones really focus on education within the city level at the secondary education. And we have a few blogs and other resources that dive into this a bit deeper, and I'll share one blog in particular of interest in the chat now. And this one covers a bit more on some particular resources that are really helpful for particular measures, such as technology enhanced classroom instruction, mentoring programs, attendance interventions. And this gives you a bit more background on these measures and the ways that they're able to be looked at and compared. And then we also have a robust set of educator resources. And so for this educator resources, they're found at cityhealthdashboard.com/education. And I'll dive into those a bit more right now with a little overview. So again, if you go here on the left side of the website, you can go down here under data and resources, and you can find educator resources. And this is a great web page if you have any interest in using the dashboard in the classroom or in your um, education initiatives. And we have a little overview here in this little video that gives you a bit more background and helps you navigate some of the resources on the site. But one of the main things that we do have on here are some high school lesson plans. So we actually created 2 lesson plans for the high school level. They've been approved and implemented at the Common Core state standards as well as for AP Human Geography. So if either of those are of interest, these are great lesson plans for you. We have them both on teacherspayteachers.com as well as Google Drive. And so I'll just show you a little overview of the Google Drive right now. The Google Drive provides you for free everything from 2 lesson plan PowerPoints, a teacher's guide to give you a bit more in-depth look at what is the dashboard, how can you use it, what does this lesson plan actually cover. It'll give you student handouts and worksheets as well as answer keys to help you really use the dashboard as a resource in your classroom to grow understanding of community level health, how to use data, and how to understand some of these. And so this particular lesson plan for teachers, we go through this particular lesson plan, looks at broadband access or internet connection within communities. In the teacher handout, we kind of give you an overview of what are these lessons and particularly what standards do we cover. In the presentation, it's a pre-made PowerPoint. So a lot of the work is already done for you. You can just come in and use these resources to really go through and teach the students. And then the students get this interactive handout to really work through the site and kind of do basically the walkthrough that I just did, but in their own way, exploring the cities, exploring the metrics, exploring how you can use these in day to day. So this is a really helpful resource and it's available for free for anyone to use. And I'll slot that Google Drive or the education link into the chat now as well. Oh, it's already in. Thank you so much, Sammy. Oops. So continuing on, we also, in addition to high school level coursework, we also have some college level coursework examples on that same education page. And so we have a plethora of examples of how the dashboard has been used in both undergraduate and graduate level coursework. So it's been used in everything from business classes, public health classes, really specific epidemiology courses, and all of those kind of class syllabuses, or not syllabuses, but the summary of how they've been used in the courses are up on the site to give you some ideas. We also have noted the university, and if you have any questions about those courses or want to know more, a lot of them link out either to the website, but also you can email us with any questions and we can connect you to the right people. And one of the great examples of how this has been used has been in one of our impact stories, which features the University of Memphis's School of Public Health. And they implemented the dashboard into their Foundations of Public Health course. This was a part of their Masters of Public Health program, and they were going towards reaccreditation and looking at how to really create more comprehensive way to obtain that core requirement for the MPH program. And using the dashboard in their site, they were able, or not their site, in their class, they were able to meet that competency for their MPH program and achieve reaccreditation. So this is a really exciting way that the dashboard is used to really propel forward the course and really make impact in data-driven coursework. Good. And another example at the elementary level of how people have used the dashboard in the past is the Arkansas Center for Health Improvement. They actually use a variety of city health dashboard measures, including frequent mental distress, frequent physical distress, and children in poverty. And they overlaid our data on those metrics with their data on school district geographies and school ratings to see how do these compare. And so on the right here, I've highlighted our measure of frequent mental distress and their measure of school rating, and then seeing that correlation. And so by linking these, the ACHI was looking to drive action towards policy change. And so they're looking at rezoning and prioritizing healthy policies so that school districts can prioritize both health and educational outcomes for their students. So this is a neat way of how dashboard data can be used in conjunction with other maybe pre-existing educational data to really drive that change at the community level. So that concludes kind of my talk on the education resources available here at the dashboard. We're always here and available to help. But I'm going to stop talking for a little and let you guys do some talking. So if you have any questions, feel free to come off mute or slot them into the chat, and I'm happy to answer any of these for you. We are always available on Twitter, website, our email, or if you want to subscribe for any updates, you can do so with the QR code. Yeah, just let me know if you have any questions, and I'd be happy to walk through the site, go over any particular issues, or talk more in detail about any of the education related metrics that I covered. And if you don't have any questions, you're more than welcome to pop off or email separately, but I'll stay on for the remainder of the time. And thank you everyone for joining.